Hey there, brain buddies. Welcome back for another deep dive where we like to take all those sources you send us and we'll basically just do a massive cannonball right into the middle of them to extract the most fascinating, mind-blowing insights. So today's episode, today's deep dive actually revolves around a pretty shocking statistic. Between 2010 and 2017, overdose deaths involving fentanyl in the U.S. multiplied by 50.
50 times. Yeah, that's a staggering increase, a real tragic explosion in the number of deaths. And the big question we're grappling with today is, how on earth did this happen?
That is the million-dollar question. And thankfully, you amazing listeners, you've provided us with an absolute treasure trove of information.
We've got a whole stack of sources to dive into, a real mix of stuff. Historical analyses, news reports, presentations packed with data, government documents, the works.
And they all focus on this really critical period in U.S. history between 2010 and 2017, when the opioid crisis was really taking hold, and then we had the sudden dramatic emergence of fentanyl.
Exactly. So our mission, should we choose to accept it,
And we definitely do accept it.
is to carefully dissect all these sources to really get a handle on how people initially responded to the prescription opioid crisis, and then how the emergence of illicit fentanyl basically threw a giant wrench into everything.
We want to boil it all down to the absolute key insights, the nuggets of knowledge that really matter, the stuff that'll leave you thinking, wow, I actually understand what went down during this crucial period.
I think the first thing that really jumps out at you when you look at these sources is this shift around 2010, this sense that the authorities were really starting to take the problem of prescription opioid abuse way more seriously.
Yeah, there's a definite change in attitude over at the FDA. It's like they realize, hey, it's not enough to just assess whether a drug is effective for a single patient. We need to consider the bigger picture, the impact on public health as a whole.
Absolutely. It was all about re-examining the risk-benefit balance of opioids with a much stronger emphasis on protecting public health.
And that's where things start to get interesting, because this shift in thinking, it leads to two main lines of action.
On the one hand, you had this push to make new opioid formulations inherently harder to tamper with and misuse, make them abuse deterrent.
And on the other hand, there's this new layer of scrutiny where any new opioid that doesn't have those built-in safety features, well, it needs to go through a super theo review by a panel of experts before it even gets approved.
Right. And it's around this time that we start to see the emergence of these REMS programs.
REMS?
Yeah, REMS stands for Risk Evaluation and Mitigation Strategies. Basically, these programs are what the NDA can require for certain medications that carry significant risks. And in 2011, they approved Abstral. It's a transmucosal immediate-release fentanyl product.
And it comes with this REMS program attached?
Yep. These REMS programs, they can involve all the sorts of things, creating patient guides, restricting how the medication is dispensed, or even requiring doctors to get special certification before they can prescribe it.
So in the case of Abstral, and then later on in 2012 for the entire class of extended-release opioids, the goal was really to try to control and minimize the risks of misuse and addiction.
And this raises a really interesting question. How effective could these measures targeting prescription opioids really be in the face of an epidemic that was about to be driven by an illicit substance like fentanyl?
A question for the ages, for sure. And while the FDA was making its moves, the federal government wasn't just sitting on its hands either. In 2011, the Office of National Drug Control Policy, the ONDCP, they launched this plan with a pretty straightforward title, Curb Pharmaceutical Abuse While Preserving Medical Benefits of Pharmaceuticals.
What's really interesting about this ONDCP plan is the perspective they were coming from. It's like, even though their focus was on prescription drug abuse, their whole strategy was based on this idea that these drugs were acting as a sort of gateway to the use of illicit drugs.
They were looking at data that suggested a pretty significant chunk of people who ended up using heroin or meth, well, they started with opioids that had been prescribed to them legally.
But we'll get to how this whole gateway theory became a subject of debate later on.
So to tackle this problem they had identified, the ONDCP proposed this pretty broad, multi-pronged approach. It was all about the importance of education to prevent misuse, the need for these prescription drug monitoring programs. The PDMPs, they wanted to make it easier to get rid of unused medications safely and to step up law enforcement efforts.
Yeah, a multifaceted approach for sure. And the PDMPs, those prescription drug monitoring programs, they played a central role in the initial response.
The Obama administration, they really pushed for the adoption of these programs starting in 2010 as a way to get a clearer picture of what was going on, who was prescribing these controlled medications and who was receiving them.
Right. By 2011, you had 48 states that had authorized these programs and 34 that actually had them up and running.
The idea was to create this electronic database where every single prescription for opioids and other controlled drugs would be logged so doctors could check if a patient was already getting these substances from other providers.
This would help prevent doctor shopping or people getting multiple prescriptions from different places.
Makes sense. But here's the thing. The implementation of these PDMPs wasn't exactly uniform. Each state had its own laws, its own computer systems, its own rules about what information was collected and who could access it.
And this created a major concern that states without a robust PDMP could become havens for illegal drug diversion and drug-seeking behavior.
Which is exactly what some critics were pointing out. They argued that the widespread implementation of these monitoring systems came relatively late. The first alarm bells about the growing opioid epidemic were already ringing loud and clear in the early 2000s.
And some people argue that if they'd acted sooner and in a more coordinated way at the national level with tools like the PDMPs, maybe they could have gotten a better handle on that initial crisis.
Food for thought for sure. So if we go back to that initial question about how we ended up with this dramatic increase in fentanyl deaths, it seems like the initial response to the prescription opioid crisis, had some well-intentioned measures like the PDMPs and the FDA reevaluation, but maybe didn't come with the force and coordination needed to really stem the tide.
Right, and then we move into the second phase, roughly between 2014 and 2017, where the focus really shifts towards those abuse deterrent formulations.
Right. The FDA approves a bunch of extended-release opioids like Targan ER, Embeta-Hysingla ER, Xtampza ER, and even an immediate-release one, Roxybond, all designed to be way harder to crush up for snorting or dissolve for injection.
What's striking about this period is the hope that was placed on these formulations as like a key tool to reduce opioid abuse. It made sense. If you make it harder to tamper with the pills to misuse them, then you should see less abuse.
Right, but the million-dollar question is, did these formulations actually have the desired impact on the overall epidemic? Especially with the rise of illicit fentanyl, it wasn't affected by these physical barriers in the pills.
Yeah, exactly. And that's a really crucial point. The increasing availability and the low cost of illicit fentanyl, it started to undermine the effectiveness of focusing almost exclusively on the abuse deterrent properties of prescription opioids.
The problem had evolved. It was no longer just about prescription drugs. It was now a crisis driven by this much more potent and dangerous substance that wasn't coming from pharmacies.
Right. And it's around this time that we also see legislative efforts trying to grapple with the crisis. In 2016, the Comprehensive Addiction and Recovery Act, or CARA, is passed. It aims to tackle the problem from multiple angles, strengthening law enforcement, expanding access to addiction treatment, supporting recovery efforts, and promoting prevention programs.
CARA wasn't without its critics, though.
Some analogies point out that it tried to cover way too much ground, lumping together all these different aspects that didn't really have much to do with each other.
Like it lacked this systematic, segmented approach.
Right. Some people argue that it focused more on the consequences of addiction, like crime, rather than addressing the underlying causes of the problem.
But there was one major step forward in this law, right?
Yes, CARA did boost and strengthen the implementation and coordination of those prescription drug monitoring programs, the PDMPs we talked about earlier.
So that was seen as a positive step towards getting a more comprehensive nationwide view of how these controlled medications were moving around.
Although its impact in the context of the emergence of fentanyl would ultimately be limited.
We also see the 21st Century Cures Act, which included some funding for addressing opioid abuse. But it seems like the specific connection to the opioid problem within this really broad law was pretty tenuous.
Suggesting that even though there was a legislative response, it may not have been as laser-focused on the core issues of opioid addiction and overdoses as it could have been.
And alongside these efforts, there was also this significant increase in public awareness about the risks of using opioids. In 2015, the FDA starts working with other agencies to improve access to naloxone in healthcare settings.
Naloxone, that's a crucial medication for reversing opioid overdoses.
And they also start distributing educational materials for healthcare professionals about pain management and the risks of these drugs.
Right, and they made some big changes to the labeling of opioids with much clearer and stronger warnings about the risks of misuse addiction and the dangers of mixing them with other substances, especially benzodiazepines.
It's interesting to note that Canada was also taking some pretty significant steps, like enacting the Good Samaritan Drug Overdose Act and making naloxone more readily available without a prescription.
Absolutely. And then there's a pretty major milestone in 2017 when Opana ER is pulled from the market.
The FDA asks the drug company to voluntarily stop selling it because they felt that the risks associated with the drug were outweighing any potential benefits.
And the pharmaceuticals, they eventually agreed to this request.
And this FDA decision really highlights the growing concern about the safety of certain opioids, especially with overdose deaths still on the rise. It's a clear sign that the previous strategies just weren't cutting it.
And this brings us to the most critical and perhaps the darkest part of our deep dive: the relentless rise of fentanyl. The sources are crystal clear. On this point, after about 2014, illicit fentanyl becomes the main driver of overdose deaths,
It marks what some experts are calling the third or even the fourth wave of this terrible epidemic.
And the key to understanding the impact of fentanyl is its extreme potency. It's estimated to be between 50 and 100 times stronger than morphine.
Wow.
This characteristic, combined with its relatively low production cost, made it a very attractive substance for drug traffickers looking to maximize their profits.
And this is where things get particularly tragic. Because of its potency, fentanyl is often used as an additive to cheaply boost the strength of other drugs. And the scariest part is that it's often mixed with other opioids like heroin, but also with stimulants like cocaine, meth, even ecstasy. And a lot of times people have no idea that even taking it.
Which increases the risk of accidental overdose exponentially. Like one of the sources says, due to its high potency, fentanyl is frequently used as an additive to strengthen other substances cheaply.
And another one says, as a result, fentanyl is commonly found mixed with other opioids like heroin, as well as with drugs like cocaine, methamphetamine, and MDMA. This mixing drastically increases the likelihood that people will consume fentanyl unknowingly and unintentionally.
And the numbers speak for themselves. As you mentioned at the beginning, fentanyl-related overdose deaths in the U.S. increased 50-fold since 2010.
50 times. That's just a mind-boggling statistic. It really paints a stark picture of the devastating impact that the emergence of this substance had in the context of the opioid crisis.
Exactly. And trying to directly measure fentanyl consumption becomes really tricky, precisely because in many cases it's unintentional. You can't ask someone in a survey about their fentanyl use if they didn't even know they were taking it.
So how do you even assess its presence and its impact on society?
Well, you have to rely on a bunch of indirect indicators. Things like drug seizures by law enforcement, toxicological analyses of urine that detect fentanyl wastewater analysis to figure out what substances are circulating in a particular community, data from drug testing labs, and sadly, overdose death statistics.
And all these metrics, while they have their limitations, they all point to a massive increase in the presence and consumption of fentanyl.
The sources also highlight this significant increase in the supply of fentanyl and the chemical precursors needed to make it in North America, which suggests that it wasn't just the demand that increased, but also the availability of this substance.
Right. And faced with this new and alarming reality, both Canada and the U.S. started adopting harm reduction policies.
Like expanding access to naloxone so more people could reverse overdoses, and setting up supervised consumption sites where people could use drugs in a safer environment with medical assistance available if needed.
And Canada has even explored some bolder measures, like providing a safer supply of certain drugs and decriminalizing possession of small amounts of some drugs.
Yeah, pretty progressive stuff. Now, looking back at this whole period, the sources offer a pretty fundamental critique. They question whether the initial definition of the epidemic was actually on point. Did they focus too much on prescription opioids when maybe the root of the problem was deeper and more complex? Encompassing the illicit drug market as well.
It's a really important point to consider. The historical analysis suggests that by defining the problem mainly as a matter of prescription opioid abuse, they overlooked other crucial factors and the evolution of the illicit drug market.
And this, in turn, limited the effectiveness of the policy responses that were implemented, despite their good intentions.
And they also cast doubt on this widespread gateway theory, this idea that most people who develop a heroin addiction started out using prescription opioids.
Right, while they acknowledge that there's some risk for a specific subset of chronic patients who are on high doses and have other risk factors, the evidence suggests that an overwhelming majority of people who use prescription opioids do not continue to use them chronically, and so are not at risk for switching to using heroin.
So it seems like there was perhaps too much emphasis on controlling prescriptions as the main strategy to prevent addiction to harder drugs, when the reality was way more complex and multifaceted, with the emergence of illicit fentanyl as a major game changer. Okay, inquisitive minds, we've been on quite a journey, a long and winding road. But we made it. So to recap, we saw how the initial response to the opioid crisis focused on prescription drugs. With regulatory changes by the FDA federal action plans and the implementation of PDMPs, then the attention shifted to these abuse deterrent formulations, and there were some attempts at legislative approaches. But the emergence of illicit fentanyl, with its extreme potency and its use as an adulterant in other drugs, it totally transformed the landscape, exacerbating the overdose crisis in a way that nobody could have predicted.
And it's crucial to remember that this combination of fentanyl's high potency and its hidden presence in other substances, those were the main drivers of that exponential increase in overdose deaths we were talking about at the beginning.
Now here's a thought-provoking question for you to ponder. Given this complex evolution from prescription opioids to illicit synthetics, What do you think are the most effective and ethical strategies for addressing the ongoing challenges of substance use and overdoses in the future?
It's a fundamental question that invites us to keep exploring and searching for solutions to this very serious public health issue.
All right, wisdom seekers, that's a wrap on this episode's deep dive, but the conversation doesn't end here. We'd love to hear your thoughts or reactions down in the comments. Did any light bulbs go off during this exploration? Were there any points that left you scratching your head? Let us know. And if you enjoyed this informative journey, please hit that like button. And to make sure you don't miss out on future knowledge expeditions, hit subscribe and turn on notifications. Until next time, stay curious, amigos.